Hi, everyone. Welcome. If you could please get started on the pre-event surveys that are here. Emma will also be sharing the links in the chat, which will take you to these surveys really help inform the content of the programming. So if you could please take a few minutes to fill those out while we wait for people to trickle in. Once Emma gets them in the chat, I'll move to the next slide. All right, so then this is an important one for the healthcare provider, or actually before I get there, we do have translations available in Spanish and Portuguese, so please click the globe icon to get started. And an important note for healthcare providers, if you are claiming continuing education units, if you are a dietitian or physician, you can claim continuing education units for this webinar. You need to register your information with Boston Children's Hospital, who is providing the credits for this webinar. So you'll need to go to this website. Emma will have the link in the chat shortly, and I will have instructions again at the end so you can make sure that you are registered. So this is the first step. If you are new to these webinars, this is the link you have to go to. If you've attended webinars before, you can skip that step and just text your attendance. So again, I will share this at the end, but you need to text the code P8BKE to the number on the screen, and Emma will also be putting that in the chat shortly. So just leave this here for a couple minutes or a couple seconds. We'll email this to you also, so don't worry if you can't get to it. Okay, great. And thank you to proud sponsor Shar for supporting this webinar. And we will get into the content now. So we are really lucky that we have the speakers that we have today. Emma Cowson is sharing the information from the Celiac Disease Foundation in the chat. She is our community engagement and education coordinator. We have Eliana and Pilar interpreting for us today, and we have Ann Lee and Dr. Ritu Verma presenting our content. So I will quickly introduce them. They really don't need an introduction, but Dr. Verma is present at many of our sessions. Actually, she is in charge of the Celiac Disease Center, and she's a pediatric gastroenterologist at the University of Chicago. Ann Lee is the lead dietitian at the Columbia Celiac Disease Center. So we are so lucky to have them both. Vanessa isn't joining us live today, but we do have a recording of her cooking demonstration. So for those of you who don't know, Vanessa is our Chief of Education and Community Engagement. She's also a chef. So that's why we have her presenting the video. All right. So I guess, oh yeah, so it is my turn to stop. Ritu, I will let you share your screen.
Okay, so welcome everyone, and thank you so much for the introduction. I am going to try and see if I can bring my slides on, which we did early in the practice session, but let's see where that goes now. So first of all, everybody's been given so much information, and I think, where did it go? I have too many things open. We just had it. All right, I'm going to try one more time. So give me another moment. Okay. Megan, I don't know where it disappeared. We just did this.
Okay, no problem. Anne, would you mind sharing your version? I think you had Ritu's slides.
Here we go. I got it.
Got it? Okay.
Okay, thank you. All right, sorry about that, everyone. Sorry for the delay. So I believe that everyone who's joined here knows all about celiac disease. But just as a refresher, we're going to go through what is celiac disease, but most important, what do we do beyond the diagnosis? So celiac disease, as we all know, is an autoimmune disease, and it occurs in genetically susceptible individuals. So what does that mean? That you have to have specific genes that make you predisposed to develop the condition. And we also know that you can have the genes, but you also have to eat gluten. And then there are some other environmental triggers that can then start off the whole cascade of developing celiac disease. What we do need to remember is that, yes, it starts the cascade, but then it heals once you go on a gluten-free diet, which is the treatment for celiac disease at this time. But you have to stay on gluten forever. So why and how do we think about celiac disease? So sometimes there are certain symptoms that make us think about celiac disease, so including things like diarrhea or constipation, abdominal pain, vomiting. And that would be easy if you had GI symptoms, that you would go see your gastroenterologist and look for and explore for a diagnosis of celiac disease. But there are some people and some children and adults who don't have any GI symptoms at all, but they may have a specific rash that is on the picture here on my right. And it's called dermatitis herpetiformis, which is a very itchy, painful rash. And then there are some teeth issues, bone density that may go down, increased risk of fractures. In children, we do see some children who have a short stature. They're just not growing. They might be gaining weight, but they're not growing in height. And that can be a presentation of celiac disease as well. Iron deficiency anemia, probably one of the most common things seen in adults who may be diagnosed with celiac disease. Liver problems, looking at neurological symptoms. So there are people who will say, I feel very foggy. It's not just because you didn't sleep enough, but it could be brain fog because of part of the whole symptomatology with celiac disease as well. So again, the thought process for celiac disease happens if you have GI symptoms, but it can be non-GI symptoms and any at all symptom that goes on in your body. So how do we diagnose celiac disease? First, you've got to think about it, so the symptoms. And then once you have these signs and symptoms, or you're at high risk of a family member or someone with type 1 diabetes, someone with Down syndrome, those are high risk to develop celiac disease. So once you get that suspicion, then you end up doing blood work, and that's where you see you do the total IgA and something called the tissue transglutaminase, or TTG. It's a blood test, and if this blood test is abnormal, then at least in North America, we recommend an endoscopy. There are a lot of different guidelines coming out where the thought is that perhaps you don't need an endoscopy, and that's a discussion you should have with your primary care provider or your gastroenterologist. But the guidelines from Europe have that if you have greater than 10 times upper limit of normal of this TTG, you may not need an endoscopy. But again, I would urge everyone, if you have a positive TTG, talk to your gastroenterologist before you go on a gluten-free diet. Have that conversation. So why is it important to diagnose? Besides having symptoms, of course, if your intestines are hurt and damaged, you're not going to be absorbing the nutrition. And you can have all the symptoms we just talked about. That can be a reason of why it's important. But most importantly, the reason to diagnose celiac disease is so that you don't end up with another autoimmune disease. And we all learn, and we all teach this in the world of gastroenterology, that we need to stay on a on the gluten-free diet to cut down on the risk of developing another autoimmune condition. So in order to be able to do that, one would think it would be a no-brainer that we do need a follow-up, right? So follow-up should be important after diagnosis. Unfortunately, there really is a paucity of data for best practice. There are so many significant variations that occur despite knowing that this is such an important fact that needs to be there. There was a study done by a group of pediatric GI celiac centers across the United States, across North America, and truly, it was eye-opening to some extent, but you saw that there were about 68% of gastroenterologists who advised patients to be seen 3 months after, and then 25% only continuing at 6 months, and then only 1.8% at 1 year. So hopefully by the end of this webinar, you will be convinced by myself, and more importantly, Anne, that it's really important to have that follow-up there. As far as repeat endoscopies and biopsies, that was evaluated as well in this study. And there were some folks that talked about doing a repeat endoscopy. We'll talk a little bit about it later on. And thankfully, most of the pediatric gastroenterologists recommended the family screening. So why do we need follow-up care? Of course, we need to monitor therapy for anything. If you get diagnosed with diabetes, you get diagnosed with Crohn's disease, whatever treatment you're on, you are following up with somebody who is in that specialty. So why not celiac disease? So it's really important to have that monitoring of the therapy because, again, it's so important to be on this diet and to be effectively treated. The diet and lifestyle affects your quality of life so much. So again, another thing to talk about in your follow-up care and get help. Early detection and management of other conditions, as you heard me say earlier, there's a high risk of developing another autoimmune disease. Easy to say, but you've got to monitor that. And you would want to be detected early, especially in children. We'd like to have our patients be detected early and manage the appropriate autoimmune conditions. And then again, you'll hear more from Anne about how it is so important. Yes, you go on a gluten-free diet, but there's more to this whole story than just a gluten-free diet. So working on these would be the reasons. And there are some studies to sort of support this, that if you follow up, this was done through and reported out in 2014, that patients who were lost to follow up definitely did not adhere to the diet. There was less frequent testing and then more positive serology. And of course, that leads to a lot of other problems. This is a beautiful study that reported out in 2021 that children who were diagnosed less than 12 years of age, so these are pediatric patients, and they had yearly follow-up visits. They were first had resolution of their symptoms. They actually achieved a negative serology when in their childhood, but even more important, they were most likely to maintain a gluten-free diet as they became adults and therefore cutting down on complications. So don't you think it's important to have the follow-up? Absolutely, yes. And thankfully, there were some societies that agree with us, and there are guidelines that came out through the American College of Gastroenterology, again, predominantly adults, but some children. So you make a diagnosis, they agreed that there should be a follow-up at 3 to 6 months. And if you look at this chart, at 3 to 6 months, you look at the symptoms, you look at blood work, talk about vaccines, and so on. And then where I maybe disagree with them is that where they said if it's an inadequate response to see a dietitian, I disagree respectfully with American College of Gastroenterology. I think that it should be follow up with a dietitian, whether you are responding or not responding. It becomes important that that happen. And then the ACG agreed that there should be a follow-up in a year and continued follow-up over time, and talked about having an intestinal biopsy at year 2 in adults. So what did our colleagues in Europe do? So this is the European guidelines, and they also said follow-up is recommended. Yay, that is great, right? So follow-up is recommended. First follow-up, they advise, should be in about 3 to 6 months, sooner if needed, and then continue to follow up every 6 months until the blood work becomes normal, and then every 12 to 24 months. In pediatrics, I do believe it should be every year rather than waiting 2 years, because we have a lot of things to think about in pediatrics. So I would say there should be a follow-up every year. And then during this follow-up, what should one do? You look at the symptoms that brought you to the diagnosis of celiac disease. Does it improve or not? Are there new symptoms that are happening? In pediatrics, we look at height and weight. In adults, we look at weight. And that's something that needs to be measured as well, along with different blood work. And we'll go through that in a little bit. And of course, assessing for adherence, really important to look at the quality of life. So what are really the recommendations? So this comes out as guidelines and their recommendations, and each center brings their own style to that. So in my opinion, if you are monitoring a child with celiac disease or an adult, all of these things have to be thought about. Truly have to think about education. Education of the patient, the child, the family, and the society is important. Looking at and screening for associated conditions, talking about planning for school, again, depending on which age you're at, whether it's elementary school, high school, college, planning becomes really critical. And that's something that we review in our follow-up appointments. Coping, how is the patient and the family coping, becomes a huge discussion in the follow-up. And if they're not coping well, that we actually have initiatives to help them. There's, of course, the burden of the disease. So looking at financial toxicity, the transition of care. Of course, our children grow up and become adults, and we need to help them move on to their adult caretakers as well. And really, most importantly, the nutrition evaluation that needs to happen at every age group itself. So I usually will say the first visit after diagnosis should be within 2 to 4 weeks. And the reason I say 2 to 4 weeks is you've just been handed down, and I'm a pediatric gastroenterologist. So you as parents have just been handed a diagnosis of celiac disease. It's huge. It really changes your whole life. So to say to somebody, here's your diagnosis, I'll see you in 3 months, seems not okay to me. So I usually will see my patients within the first 2 to 4 weeks, so that now it's a discussion about the disease, but also how are you dealing with it as parents? How are you dealing with it as the child? And how are you dealing with it as a family? And then, of course, after that, every 3 to 6 months and so on. And as we talked about earlier, yearly visits are important. The comprehensive care team should always be at every visit the gastroenterologist, the dietitian, and the psychologist or a mental health provider. Is it possible in every center? No, but it is something that we want to achieve and try and get to because this disease affects all of us in big ways. And then we have multidiscipline approach where, let's say, a child has diabetes and has celiac disease. Having a multidiscipline clinic that has both the endocrinologist, the gastroenterologist, and a dietitian is so valuable. And that's one of the things we do have here at the University of Chicago. So again, study done looking at coping, up to 30% of children, if you just think about that number, up to 30% of children with celiac disease have mental health challenges. So don't you think again that it's important to follow with a mental health specialist who can help the family and the patient with that? And we know that if you have a lot of social adversities, the outcome of the disease is not good. So we talk about this support, and then what else is done during that visit? So blood work. So not every visit do you get blood work, but initially in the first few years, as your serology is still positive, you get the blood work done. And I'm sure everyone who has celiac disease is very familiar with these blood tests. But as a minimum, the tissue transglutaminase should be done. And I would really caution people that if your TTG does not normalize in the first 3 months, don't panic. What you want to see is that the numbers should be improving. Each time you get blood work done, the antibodies should be better than before, and that's fine. And don't stress out if it's not normal in the first year itself, but each number should be better. The second thing we do with the blood work is looking at different vitamin levels. And again, Anne will go through more with that. We know that the gluten-free diet is deficient in some of these things. And we also know that if you have intestinal damage, you're not absorbing all these nutrition. We also know that if your belly hurts every time you eat, you're not going to be eating all of these things. So we do monitor for different vitamins. And then we also look for hemoglobin A1C as a marker from a diabetes standpoint. And more recently, there's conversations, and what we are doing is also looking at type 1 diabetes antibodies, knowing that a number of people with diabetes will end up with celiac. The question is how many celiac patients will end up with high risk of diabetes, and hence the antibodies are being looked at as well. Perhaps not as routine, but definitely a lot of centers are now looking at the type 1 diabetes antibodies. The other big autoimmune disease that's associated with celiac disease is thyroid. So we do monitor thyroid and the thyroid antibodies. So this is done routinely, and then we repeat every year at least all of these labs to follow over time. And then family screening is discussed. So the question comes up, how often should you do family screening? There truly is not a total timeline. We all agree that family screening should happen. My personal bias for the siblings of the child who has celiac disease, I recommend yearly screening for that sibling until puberty. And the reason I say yearly is because, again, you don't want to miss a window of growth for that sibling. And also sometimes we say year and then we forget, maybe it turns out to be 2 years, 3 years, and so on. So in my mind, the siblings should be screened yearly till puberty, because then their growth is done and then you can do every few years. But again, remember, a lot of families go gluten-free once one person is diagnosed. So everyone who gets screened should have enough gluten in their diet. The next thing that we monitor in the lab, in the visits, is of course to look at symptoms. So if someone's symptoms started off with abdominal pain and they're not improving on a gluten-free diet, then we have a bigger discussion with our dietitians. We have our psychologists help out. Is the abdominal pain more due to stress, or there are other things going on? There's some gluten cross contact and so on. Those things are looked at every visit. And then we look at the other reasons. There are other reasons. You can have other conditions along with celiac disease as well. Could be IBS, could be inflammatory bowel disease, and so on. And if you are not improving, then we start looking for other reasons for those symptoms to be there. And sometimes we end up with doing an endoscopy, perhaps endoscopy more often with adults than in children. But one of the things we all talk about and we all agree in the world of gastroenterology is that if there is a lack of clinical response, then one should do an endoscopy. If your antibodies continue to be high and you're still doing a great job and your dietitian says you guys are doing a wonderful job, then again, there should be an endoscopy to see if there's ongoing damage or not. And many a times we will talk about doing an endoscopy to look for intestinal healing as well. So don't run away from the endoscopy if it's needed. We don't generally do it in pediatrics on a regular basis, but there are definite indications in pediatrics and definitely more indications in the adult world for follow-up endoscopy. So education is a really important part of your follow-up. And it's important not just to talk about a gluten-free diet, but to really do it developmentally. A child who is 6 years old has a different need for a gluten-free diet as compared to someone who is now a teenager. So ongoing education is really important, looking at family dynamics and making sure that the child is ready for college and school. And then early detection of all of these nutritional imbalances, talking about non-dietary therapies, clinical trials, getting the family and the child involved in advocacy, empowering the child becomes part of what we do as a follow-up visit, and looking at which population is at the most high risk. So children who are in a vulnerable group, like another disease itself, it's hard for them to stay on a gluten-free diet and manage their diabetes and so on. Going off to college becomes another thing. So why do we have the follow-up is needed? Because we know that if there's chronic gluten exposure, higher rates of mental health disorders, higher rates of cognitive issues, higher rate of anxiety and depression. So who is the doctor who is going to help us get this all better? And that is our dietitian. And I'm going to hand over to Anne.
Thank you, Ritu. Okay, I'm going to share my screen and we should be able to okay. I just need to get it from the beginning and then we'll be good. There we go. Okay. Sorry. Ritu, I'm going to skip.
And
right
I think you're sharing the presenter mode.
Oh, okay. And how do I do that differently then? Is that okay now? Or
It's still in the presenter mode. And I think it's those,
Like
there's
the
three little
displays.
buttons at the bottom, three little dots.
yes.
Hide presenter view.
I'm sorry.
Hide presenter view. Okay. Now hit the button to the on the bottom.
Okay, mine is on the top. I'm sorry, everyone. That
Here, and click slideshow on the top bar.
I got it. Okay. Did that work?
Nope.
That'll be.
Oh yeah, that might work.
I apologize. It worked before, so my apologies for it. Did that? Any other suggestions?
Yeah, give me 1 second and I will share.
Okay, perfect.
Yeah.
Then I will stop sharing.
Yeah.
Okay.
And which you are starting here?
26.
Yep. Okay. Sorry, everyone. Bear with us 1 moment.
Okay, we can go to the next slide and just get started. So as Ritu so lovely described all the background of celiac disease and the reasons that we're here today to look at follow-up and things, one of the things that we need to do is to actually step back to basics as well and say, you know, the treatment is the gluten-free diet, but let's look at what that diet is. So we know that there are many, many foods that are naturally gluten-free, and we want to emphasize those because we want to look at the diet as not just what to take out, but the things to include in. Gluten is found, it's a protein found in only wheat, rye, and barley. So things like spelt and semolina and bulgur and couscous and beverages like beer and malted beverages, those are the things that need to come out. But there's no need to take out all the other things. And on the next slide, we'll see the, you know, really the question of what is in a gluten-free diet, and is it, even though it's the only treatment for celiac disease, is it indeed a prescription for health? And we can see on the next slide that a wheat-based diet is naturally high in fiber and B complex. We have to also agree it has a certain degree of wonderful taste and texture and palatability, but also all your wheat-based foods are required by the FDA in the US to be enriched back to their natural state. So if during processing they lose any iron or B vitamins, those are added back in so that the wheat-based products are a natural source of B vitamins and iron for the population. Unfortunately, the FDA does not require that same fortification of any dietary products, so that your gluten-free products don't have that same enrichment that our wheat-based products do. And on the next slide, we can see some of the dilemmas with the gluten-free products is that traditionally we're using starches, not whole grains or even whole flours. It's typically done with rice, potato, tapioca, corn. Unfortunately, grains that don't offer the same density of nutrients that our wheat-based grains or gluten-containing grains have. Additionally, to try to achieve that same texture of our wheat-based products, they tend to have more sugar, salt, gums, and oils added to try to make them more palatable. And on the next slide, we can see there's been several studies done that really look at the impact of following a gluten-free diet over time. Hallard did a study many, many years ago, but it really is the benchmark study on the nutritional quality of a gluten-free diet. He followed a population of 30 adults diagnosed with celiac disease for 8 to 12 years, and then reviewed over time during the normal follow-up the body weight and lab values. And what he found is that over time, men increased about 9.8 kilograms, and that's close to almost 20 pounds, and females increased 9.9 kilograms. Interestingly, though, even though there was this increased weight, all of 56% of the patients had signs of nutritional deficiency, which was poor vitamin status. They had low folate, low iron, some developed anemia, but these were seen even though their endoscopy showed absolute remission of any villus damage. So they were completely healed and able to absorb, but they did not have the same nutritional status. He then looked at, with his dietitian, the number of bread servings and things that patients actually ate. And he found that they ate the same number of servings of bread and cereals, but the folate level and the B vitamin level in the gluten-free products was much lower. The Valletta study in 2010, also a good benchmark in pediatric world, found that out of 149 pediatric patients, that the body mass index at diagnosis was measured at diagnosis and then at 12 months. And what we found is that the percentage of children that were in that overweight category doubled to 21% after a year on the diet. And the number of children that were obese at diagnosis increased from 3% to 4%, which is statistically significant while they were on the gluten-free diet. The Cabini study was another one that looked at adults and compared the body mass index again at diagnosis and then later on. And again, we found that, you know, the shift was for all the patients to increase at least 1 or 2 marks on their BMI score, which has huge health impacts overall. And the mean BMI went from 24, which is the upper limit of normal, to 24.6, which puts that group into the overweight range. And again, it was the majority of the patients. So on the next slide, we can actually see what the root cause of some of this is. When we look at diet studies and look at our patients eating a gluten-free diet, we can often see that the amount of calories they're eating is comparable to the general population, but where the calories come from are vastly different. There are lower calories from carbohydrates, lower calories from protein, but higher caloric intake from the total fat, from saturated fat, and from sugar. And on the next slide, when we look at kind of the carbohydrate section of the diet, we find that, and the study was done in Italy, which explains why there was less pasta eaten, but the amount of cereals that were consumed was statistically significantly higher. The bread was decreased, but the amount of cakes and sweets and desserts was also higher. So that prompted us to do a study, which we detail on the next slide, which was our grain study, where we really looked at a cross-sectional study of 50 adults that were biopsy confirmed and on the diet for the year. And we looked at their intake, and we focused, like the previous study, on what grains they were eating. But we also looked at the level of processing. And on the next study, you can see the description of how foods are processed and how they're defined. So we did a modified NOVA classification, which we divided foods into the unprocessed or minimally processed group, which is your whole grains, the processed group, which have only 2 to 3 ingredients and are processed, but not to a large extent or with multiple ingredients, and the ultra processed, which has multiple ingredients and is more highly refined. And on the next slide, we can see what the grain consumption patterns were. And we found that 88% of the intake was reported in the ultra processed products. We did see 41% did have some of the alternate grains beside rice, corn, and potatoes, but they were predominantly in this ultra processed form. On the next slide, too, we see further some of the breakdown. When we looked into the grains that the people were eating, our patients were eating, it was predominantly brown rice or white rice. We had some people that had quinoa, some that had oats, but there was a lot of those ultra processed foods of cakes and breads and things. The next slide actually breaks down how much of each of these products were shown, where we could see that you can now see the amount of rice and brown rice that was consumed and the low quantity of those other grains. Why this is so important is that, yes, brown rice is a whole grain, but it doesn't have as much of the B vitamins, of fiber, or iron as the other grains like quinoa, millet, teff, and oats do have. On the next slide, we look at the degree of processing of all those products. And you can see that the majority of products consumed that were gluten-free were in that ultra-processed form. In that ultra-processed form, the main ingredients were white rice flour, rice starch, cornstarch, and potato starch. So again, we see that huge negative impact on your nutrient intake from the type of foods that our patients are eating. On the next slide, we can look at how do we really move to enhance the diet? How do we get to change it? And we really want to encourage our patients, our healthcare providers out there, we really want to steer our patients. And for our patients, I want you to shop different aisles in the grocery store. I want you to kind of get out of the gluten-free aisle and go look at some of the naturally gluten-free sections of the store. We want to decrease the amount of packaged and processed goods we have. We really want to focus on the use of gluten-free whole grains and really emphasize naturally gluten-free foods. But that said, as Ritu has pointed out, the diet impacts not just the individual, but the whole family. And we must be realistic. Family life is busy. We've got people running in all different directions with work and school and activities. So we have to realize that, yes, packaged and processed food are not forbidden. We just want to minimize them. We want to make sure life is easy. On the next slide, we really continue to look at practical considerations. We must consider each individual's nutrient needs. Your needs are going to vary over time. Your needs are going to vary by age and gender. We also have to look at that person's place in the family spectrum. What are the family dynamics? What is the work life like? What is school like? What are the stressors? What's the food environment? We have to ask all these questions. And cost, we'll look at the next slide, where we have to consider the impact of the cost of these gluten-free foods on our patients. This is a study that we did several years ago where we really looked at the difference between a regular product and a gluten-free version. And you can see that all of them are well over 200% more expensive for the gluten-free version. We followed up this study on the next slide, comparing the cost for that initial study from 2016 to 26, and we found that even though there were more gluten-free products in the market, the cost remained prohibitively high. And I can tell you, anyone who's been in the grocery store lately, this hasn't changed. We are seeing, again, this very, very high level of added cost for a gluten-free product, close to that 200% again. When we look at the next slide and we say, well, there's so many more products now, and the mainstream market, mainstream manufacturers have really come into the marketplace, hasn't that made a difference? And what we find is it hasn't. We still see, even though the mainstream manufacturers like Nabisco and General Mills have started producing gluten-free products, they still are they're still over 100% more expensive than the wheat-based product. So that even though we have more variety, we're still paying more for that gluten-free product. So the dilemma then we look at is, so what do we want? How do we navigate this? And so on the next slide, I want you to go back to basics. And this is a way to save money. When we look at, and everyone's seen this, I'm sure, the My Plate thing, is that we really want to look at building a healthy diet that is good for our patients, but also good for our pocketbook. So when we look at your plate for each meal, half that plate should be fruits and vegetables. And again, naturally gluten-free, there's not an up cost to those at all. We need to look at a quarter of the plate being protein and a quarter of the plate being grain. Now, many of us in the States think of protein as being the mainstay of each and every meal. It really, from a nutritional needs point of view, only means a quarter of your plate. So each serving, if we look at having 5 or 6 ounces a day, that means only 2 to 3 ounces. Think of how much you could save before eating half as much of that chicken, okay? But let's fill in that plate with the gluten-free whole grains. Using the whole grains are going to help fill you up, keep you satisfied, in addition to supplying all those nutrients that each of those studies highlighted that we're missing. On the next slide, we're going to think of, really enhancing adherence through changing the diet. We want to make sure that the diet is healthy. As we're making it healthy and more naturally gluten-free, we're going to reduce some of the cost. It's going to increase availability. And it also makes those food choices more normal when you think of eating with other people. You're eating the same kind of salad. You're eating a grilled chicken. We're doing things that are easy to incorporate into our social, work life, and family life. So that on the next slide, we're going to look at adherence, and from a health practitioner point of view, we need to look at not just ensuring our patients have the best knowledge and information to have a nutritionally dense gluten-free diet, but also let's look at how we're measuring adherence. The trouble is that there's been several different tools that have been developed to measure dietary adherence, but there's been no consensus on which tool is really best. And we're going to look at the tools in just a minute. But important is that when we look at the different studies that have measured dietary adherence, it varies from only 23% of dietary adherence up to 90 or 98% of dietary adherence. And we really, as healthcare providers, question, is it that we're measuring things different, or is that lack of adherence something we need to be even more concerned about? So on the next slide, we actually look at the different tools that are commonly used today, everything from just the standard dietitian evaluation to the CDAT. There's a gluten-free eat, there's a 4-question biology tool. But what we find is that none of these actually correlate well when we look at the celiac antibodies or even the endoscopy. And so we're in this dilemma where we need to educate our patients We need to assess how well they're doing, but we don't really have a great tool to do that yet, or a consensus on which tool is best. On the next slide, we can see that there was a great study done that compared all of these, and indeed the average adherence scores for the standard dietitian evaluation was only 50%. It was 91% in the CDAT, but they found there's no correlation again between the different measures or using it compared to serology and the endoscopy. So on the next slide, the bottom line is really there's no universal way to measure adherence, but more importantly is to have that good conversation with your patient, to really ask how they're doing, to really make sure of you're talking to them and asking not only how are they managing the gluten-free food, but how are they managing it in their social life, in their quality of life. We really need to think of adherence, not just are you following the prescription, but what are the motivators to adherence? What are the barriers that our patients are facing? What can we do as their dietitian and healthcare professional to help minimize those barriers, change them into motivators, help guide them to choose not only a healthy gluten-free diet, but one that fits in their family and for their food environment situation. And we always have to ask, when someone doesn't appear to be adhering to the diet, is it just inadvertent exposure? Is it lack of knowledge? Or is it these other social barriers? And so we as healthcare providers have to do a really better job on helping our patient navigate this. On the next slide, we look at the reasons to do this. The long-term complications are several nutritional deficiencies, the weight concerns that we highlighted before in those studies, the increased risk for autoimmune diseases, all the continued gastrointestinal symptoms and other comorbidities, infertility, things that are going to impact a patient's life enormously. And we need to make sure that they're aware of these, but not fearful, and give them the tools to navigate life with a balance of adhering to the diet, but balancing that diet within their lifestyle. So the next slide kind of looks at these long-term, complications in terms of what do? We want to individualize our counseling. That's so important. We can't just hand a sheet of paper that describes a gluten-free diet to our patient and think that that's it. That's where, as Ritu mentioned, follow-up is vital. We encourage diet counseling as close to that diagnosis as we possibly can. We encourage them to follow up 1 month later, then 3 months later, then 6 months later, and every year thereafter. If there's any ongoing symptoms or questions, I tell my patients, if something comes up, I want to see you, because that's the way we can encourage them and help them be adherent and manage and maximize their quality of life. We really do want to encourage those good gluten-free whole grains and naturally gluten-free foods over the packaged and processed products. The other thing I'm always telling my patients is, I want you to move every day. Part of general health and part of gastro motility and function is moving. And I don't care if you're out gardening or walking or hitting the gym, but it's really important to be active every day for your bone health and also for your mental health. We also encourage my patients to be aware of self-care. Yes, we are all busy in our life, and it's so important to take care of everyone in our sphere, but that means taking care of yourself too. So engage in mindfulness, meditation, deep breathing, whatever it is that gives you that peace of mind. I want you to do it on a routine basis. So on the next slide, my conclusions are really, we need to think beyond the diagnosis and consider the individual within their sphere of life and food environment, and really kind of coach them and counsel them accordingly. Emphasize really a holistic approach. And as Dr. Verma said, we need more than just the dietitian. We need the psychologist, we need the doctor, we need everyone to make sure that our patients are happy, healthy, adherent without guilt or vigilance. And the next slide, just to thank you.
Great, thank you so much, Anne. Just everyone give me one moment to share the next slide deck. And then now for the fun part of the cooking demonstration. So we are going to be watching a video of Vanessa preparing a sheet pan steak, tips, and veggies with lemony garlic breadcrumbs. Sounds so good. You can scan the QR code here to access the recipe on our website, and we will be posting the video on YouTube as well. So you can always come back to this for reference. And actually, Emma, if you wouldn't mind sharing the link on Eat Gluten Free, that way everyone can find it.
I've had a really, really busy weekend. My kids were in a soccer tournament. We had 10 soccer games. And so we come home, everyone's hungry, and I need a nutrient-packed meal that is easy to make and is done really quickly. So tonight we are making steak tips on a sheet pan with a second sheet pan with some roasted veggies, and we're gonna elevate it a little bit with some awesome char breadcrumbs that we're gonna toast up with some garlic butter and some lemon zest. So we're gonna sprinkle those all over the top of the veggies, and it's gonna be absolutely delicious. So this is super simple. So in my glass bowl here, these are just steak tips. They were plain steak tips. I put a little bit of oil on them. This is a garlic oil that's infused with herbs. I'm gonna make sure I shake this up. So I'm a really big fan of basting oils, and you can see in the bottom here, there's lots of different herbs, and that's what gives flavor to our food. We always, think of with the gluten-free diet, plain, but that's the opposite of what the gluten-free diet needs to be. It can be packed with flavor, and this is one of the ways to get that flavor. So this is a garlic oil. It has rosemary and basil in it, and so I'm just gonna put that on top of my steak. I'm also going to season it with some garlic salt. Since I was a little kid, my grandma, my mom always used tons of garlic salt in the kitchen. And so that's my favorite thing to use on my proteins and on my veggies. So now we're just going to make sure we get it all evenly coated. And we're going to let this sit just for a minute while I get my veggies prepared, and then we'll put it onto the sheet pan. So now the veggies are super, super easy. My kids love mushrooms, so I'm gonna do mushrooms and asparagus. All I did to these mushrooms was I pulled out the stem on them. So we'll put those on the sheet pan, and we'll put some asparagus. So asparagus is a newfound love in my house. It was only in the last few months that my kids started actually really loving to eat asparagus. And so now I make it all the time. It's a great way to get nutrients into their body and a green vegetable. So again, I'm gonna use my garlic oil that's already seasoned with herbs. Just gonna drizzle it on there. Get some all over the mushrooms. And the garlic salt. This is the simplest meal you could possibly make. Very few ingredients. I think 4 ingredients, 5 ingredients with the salt. It's super simple to make, no fuss. Then we'll take my tongs and just toss it up to make sure the seasoning gets all the way through all of the different asparagus pieces. And we'll toss those mushrooms. All right, so I've preheated my oven to 450 degrees. Now, again, we want this to be simple. I don't want to have to bake one pan and then the other pan. And so we have to find a cooking temperature that will work for both. So with the steak, I want the steak to get nice and brown. And so I want to cook it on a broil setting, but I don't want to broil my vegetables. So I'm going to go ahead and put the vegetables in a 450 degree oven and let those cook for about 5 minutes while I get the steak arranged on the pan, and then we're gonna bump the temperature in the oven up to broil, and we'll put the steaks on the top rack to cook. The veggies are already in the oven. Now I'm gonna go ahead and put my steak onto the sheet pan. You could also throw all of this onto the grill. This would be spectacular on the grill, and normally I would cook this on the grill, but unfortunately there's a nor'easter coming through Massachusetts right now, and so we are staying inside tonight, and the broiler will do just as good of a job for us, no problem. This is also a meal that you could absolutely have your kids help you with in the kitchen. There's really no sharp objects involved. Seasoning is something great for kids to learn how to do, and it's a really simple prep method. I know that when I was first living on my own in an apartment after college, sheet pan meals were one of the first things that I started making for myself because it's really easy to make, it's really few ingredients, and it's no fuss. So a great thing to teach your kids how to do. All right, so the meat is all ready to go. I'm gonna wash up, turn up the oven to the broil setting, and we'll get those popped into the oven. All right, so in my pan here, I have 2 tablespoons of salted butter, and I have about a half a teaspoon of my garlic and herb oil. I'm just letting that get nice and warm, and I'm going to add into it, as soon as it's fully melted, half a cup of these gluten-free breadcrumbs. Now the idea is that we're gonna toast them. We want them to get nice and toasty, and they're gonna give this nice, delicious added crunch onto our veggies when they're done. So we're just gonna cook these for a couple of minutes here. We're gonna stir, 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 because we don't want them to burn. So our breadcrumbs are all toasty. Now I'm gonna take a lemon and add the zest of a lemon. This just gives it a really bright and fresh taste. I love lemon in everything. I would add it to every single dressing I make, every sauce. It's the perfect acidic addition to cooking. And so we're just gonna put some lemon zest in here for that extra flavor boost. We'll go ahead and stir those up. And the breadcrumbs are ready to go on top. Super, super simple. Now let's get the rest of the food out of the oven. All right, it was that simple from start to finish in 12 minutes. The veggies were in the oven for a total of 10 minutes, the meat about 8. So you can see it's got that beautiful browning on top, just like we like to have on our steak. Our veggies are soft, but they're not overcooked. There's still a little bit of crisp to them. So I'm just gonna go ahead and top my asparagus with the breadcrumbs, our lemony, garlicky breadcrumbs. I'm gonna start with just a little bit on them, but then let my family add more to their plates as they serve themselves. And voila, dinner is ready in less than half an hour.
Yeah, dinner's ready!
Okay, so
Oh,
before we wrap up for Q&A, I'm just going to put this here. We do ask you to complete these post-event surveys so that we can continue to come up with new exciting topics that are relevant to you. For the healthcare providers, this is the backup system to the texting for the credits. So if you have questions or you have issues, or even if you don't, we still want you to fill out this survey so that I have a backup list of every healthcare provider that attended. And Emma, I will ask you to share those links in the chat so we can move on. This is the information on getting your CEU. I will just leave this for here 1 second because Emma did share this earlier in the chat and she will reshare it again. And then coming soon on December 1st, we have our final culinary medicine webinar of the year. We have the team from McMaster University in Canada presenting that webinar, and it will be on the Mediterranean diet. So really excited about that. Okay, so I'm going to stop sharing my screen because that way I can see the questions. Okay. I'm going to start with this one. Is periodic blood work an acceptable way to evaluate how effective your gluten-free diet is and level of cross-contamination?
I think the practical answer is yes, but the real answer is no. So I think you know, the TTG, if you just think about it, if someone has a cross-contamination or an ingestion of gluten 3 months ago, and you do a TTG today, it's going to be normal if everything else is fine. So it's a only test that's readily available right now. So that's a test that we do, but you have to do that in combination with a conversation with the family, with the child, with the dietitian, And I think you need an experienced dietitian. I think if somebody walks in, or even a celiac expert, if you walk in and say, "Have you eaten gluten?" the answer is going to be no. So I think that conversation is important than just the DTG. What do you think, Anne?
I agree because we live in a world that's really gluten laden, and we need to really counsel our patients that they need to do the best they can. Some gluten may get in, and I know that, as you said, the only tool we have is the TTG. The TTG is great to help us diagnose, but it's really not a great monitoring. And so that's where I want our patients to get routine TTG so we can follow that trend down to see their healing, but it's not a great reflection of what they're doing day to day.
Great. We had several questions about gluten-free grains and how to find good recipes that include gluten-free grains. And Anne, I was wondering if you had a go-to resource.
I'm actually going to highlight the next webinar.
Yeah.
I want you to look at the Mediterranean cooking. For gluten-free grains, the first thing I would say that makes life really easy is get a rice cooker. I know we think of a rice cooker as something to cook rice in, but you can cook quinoa in there, millet in there, and even one of my favorites is to actually, especially if you have kids in the family, to make a container in your house of mixed grains. So take your rice, add some quinoa, add some millet. It can all be cooked together. And that's a great way to help families kind of transition from just rice to more varied grains. But Megan, I could share with you, it's typically, in terms of cooking it, it would be 1 cup of grain to 2 cups of fluid for people. And a rice cooker, you literally put it in, press the button, and in 20 minutes, your grain is done. But I want people to really explore quinoa, explore millet. Sorghum is a great one to use. It's now getting to be more that fall season of where we do stews and chilies and things. Sorghum is a great grain to replace barley in soups and stews and things. And even if we just start there. In terms of recipes, look for the Mediterranean kind of cookbooks and things, and you'll find great recipes there.
Yeah, I think, there are a lot of recipes out there. It's kind of hard to put a go-to source. We do have a lot on our website, on the Celiac Disease Foundation website. But truly most recipes where there is a grain, you can swap for something that's gluten-free. So quinoa, using quinoa and stuffed peppers, for example, or, that there's a lot of good tricks. So we'll share more in the Mediterranean diet webinar for sure. And then I'm just going to do the last question because I know, Anne, you have a patient right after this. Can you comment on follow-up and symptoms? There are several questions in here about people saying that they don't feel better since they've started the gluten-free diet, and they're wondering what the next step should be. The symptoms reported are like chronic fatigue and migraines were the two that I saw.
Okay. I'm going to start, and then I apologize, I'll have to exit to go back to clinic. One of the things I tell all of our patients is that when we transition from a wheat-based diet to a gluten-free diet, we have to remember that we are now eating things that are a little bit less nutritious, but also your body needs time to heal. And the GI symptoms often are things that kind of resolve first, and fatigue and other things take longer. And so just, again, be gentle with yourself, work with your doctor and your dietitian, and really look at your diet to make sure you're getting those foods that are high B vitamins, high iron, but also consider, how much fiber is in that diet too. You don't want to go from no fiber to adding beans and grains and things because your gut will feel like it exploded. So give yourself time, be gentle, and slowly make the transitions to the whole grains and things.
Great.
Ritu, do you have something to add to that? I'm sure.
No, I agree. I think that we have to have patience. It's your intestines are, they're damaged. So you have these, but then you have these neurological symptoms, as you mentioned, those always take a longer time. And I think the other thing we end up doing going on a gluten-free diet is you look at the cookies and you look at the cake. So there's a lot more sugar and things that we naturally speaking, right? I mean, if you have a child who has celiac disease and you're telling them you cannot eat all these things, what are you going to go? You're going to go get the gluten-free Oreos, right? To make that child feel better. So making the diet a little bit healthier without going overboard, because again, keep that in mind, the anxiety that the child is going to have. So you can have some cookies, but maybe have some protein with that. That'll balance out and definitely. And each day you should see an improvement. If you're not seeing an improvement, then again, something that you want to see, but it takes time. It just takes time, but there should be improvement every day. If it's not happening, then get back to your clinical team.
All right, great. Anne, I will let you run. Thank you everyone for joining the presentation today. It will be recorded and posted on celiac.org on the Culinary Medicine webinar webpage. And we will see you in December for the Mediterranean diet presentation. Thank you.